Okay, in today's Better You segment, acne is most often thought of as a teen problem, but unfortunately, it doesn't end there. There are great treatments available, though. That's the good news. And Dr. Deb Atkins from Dermatology and Associates joins us. Good morning.
Good morning.
How are you?
Good.
Good. This is one of the things that you're great to talk about, and you're great to talk about on so many levels. But
Yeah, thank you.
adult acne is frustrating. I have plenty of girlfriends that are my age that really battle with skin problems. Why do some women battle with it and some people battle with it and some don't?
You know, many of the people that are plagued as adults with acne had acne as children. So probably half of adults have some problems with acne. The frustrating thing is hormonal changes, medicines people are on, and stress, which we all have as adults, can exacerbate those factors. But there's a lot you can do to change that.
So when people come into you, you say, what's changed in your life? What are the questions that you ask?
We ask if they are, if they've changed their diet, their medicines, if they're under a lot of stress. The problem is a lot of these things you can't help. You can't change stress for some people, but you can put them on medicines that help. And there's things you can do at home as well.
Okay, so let's go through some of the basic things you can do at home to keep our skin good. And then let's talk about the new stuff that you're using to treat adult acne.
Well, one of the biggest mistakes people make at home is they overtreat. They wash and wash their skin, they dry it out. So something that somebody can do at home that helps a lot is just gently clean the face twice a day with an antibacterial or mild salicylic acid cleanser, just twice a day. Treat areas that chronically break out with something like a sulfur-based topical like Clearasil or benzoyl peroxide. But what you don't want to do is clean your face 6 times a day.
Scrub it like crazy.
Exactly. Use facial scrubs, put benzoyl peroxide all over the face, because then what happens is people dry out more. They have microscopic breaks in their skin, and then they get more bacteria in there, and they're dry and breaking out.
That's not good. Okay, so just keep the face clean, but don't go crazy.
Exactly.
Is it a myth that a lot of foods cause acne, like chocolate and things like that?
It's an interesting issue because there aren't very good scientific studies that show that diet really affects acne, but there's very compelling stories from patients who tell you that they know certain foods make it worse, and obviously they try to avoid those. So it's interesting that there's sort of a discrepancy there.
You talked, pregnant women probably come in with acne, because I know, a lot of times when you first get pregnant, there's that hormonal change, and all of a sudden you're looking at your face and
exactly. In fact,
what's
one of
happening?
the pictures we're going to show later is somebody who had a laser treatment for acne that was pregnant that had never had acne before.
Oh, okay, let's look at some of the pictures. Which one is this one here? Is that the one you're talking about?
Yeah, this is a gentleman who had a treatment called Smooth Beam, which is a non-ablative laser for acne. And the wonderful thing about Smooth Beam is it treats not only acne, but scarring from acne. And it's non-ablative, meaning there's no downtime because it doesn't ablate or strip the skin. Somebody can have the treatment, be back at work half an hour later, no longer red, and it works over the successive months. Often patients have 3 to 4 treatments, but it's great because you treat not only their acne, but their scarring. And for a lot of adults, they have a little bit of recalcitrant acne, but it's more the scarring that bothers them.
And it looks bad, too. And you know what? You can get the scarring on other parts of your body, too. Can you use that laser any part of your body?
In fact, this was initially used for back acne.
Really? What about Accutane? Is that still being prescribed? Is that still popular? What are the drawbacks of that?
You know, Accutane is a very serious drug in that it can cause some liver inflammation and some other problems, but it's a great treatment for a lot of patients that have recalcitrant acne. For children, often it's children that have terrible, terrible scarring acne. For adults, they may not have such difficult acne at the time. It's just recalcitrant. It goes on and on and on. They never know when they're going to break out. So for adults, it's really wonderful because it can cause a really long-term remission. But it's not our first line of treatment because there are some potential side effects.
Okay, so there's a lot of good treatments though out there available, and that's the positive thing with the lasers and the Accutane. Okay, Dr. Atkins, thank you so much for joining us this morning.
Thank you.
We hope you'll come back and we'll talk about other fun skin stuff. Yeah, KUSI News Time is 6:49. Understanding the risks of hormone replacement therapy. Previous studies show conflicting results over whether HRT is safe and effective for postmenopausal women. A doctor is going to be here at 7:40 to talk about the pros and the cons. End your refrigerator and pantry mess forever. Away with clutter is here at 8:15. It's advice on how to keep your fridge and cupboards clean and organized. And he's best known for his daytime talk show, but Regis Philbin started his broadcasting career right here in San Diego. Stay tuned. I'll talk one-on-one with Regis Philbin at 8:30.